All right. Okay, so it so happened that in the summer of this year, John Bachman called me up and said, "Can you do an article for a special issue of EM magazine?" I said, "What special issue is that?" And he said, "Well, we're going to do one talking about accountability research." And I said, "Well, that's fortuitous because we're going to have a workshop in January." And he said, "Well, that works out great." So it turns out that in October, the special issue of EM came out and it had 3 articles. One, there was an intro by John Bachman, and then there was an article I did on looking at results of air quality management programs, focusing on emissions and air quality changes. There was an overview of HEI's recent research on accountability and public health outcome research, and then Dr. Pope provided a summary of some of the recent studies that have looked at accountability largely from an intervention basis, but talking also about some of the longer-term studies. So I'm going to give a short overview of these, even though the authors of the other 2 articles are in the house. I gave them the opportunity, and they gave it back to me. So I will cover this hopefully very quickly. And these obviously are in the October issue of EM. If those of you are interested, those actual articles are available as well. So the first study the article that I put together was simply trying to look at what were some of the available information we have on trends in emissions and air quality over the past couple of decades, and how air quality has responded to programs that we've implemented over the last decade or so. And over the last 2 decades, as I mentioned earlier, SO2 emissions have dropped by over 70%. This just shows you this slide shows the trends in emissions. The top one here shows total emissions of NOx, SO2, and VOCs emissions, and then the bottom graph on the left-hand side shows trends in NOx and SO2 emissions for utilities and for mobile sources, and you can see that all of them have been declining, although not in proportion to each other. And then on the right-hand side, you can see these are air quality trends for ozone, for PM2.5 annual concentrations, and for PM2.5 daily concentrations. And again, they've all been declining as well over the last couple of decades. And especially in the last decade, we've seen a lot of improvements as we put in place certain regulations. So, so what I used the article to do was sort of try to discuss whether there are some recent assessments that we could be informed by in terms of air quality responses to regulations such as the NOx SIP call. And in fact, there have been a couple of studies that have looked at those types of regulations. And again, they found, while not fully proportional responses, there's certainly been decreases in ozone resulting from the NOx SIP call. The questions become, of course, why is there so much heterogeneity in response, and why isn't there a direct proportional response? And that has to do, obviously, with the effects of meteorology and the reductions in other sources of NOx emissions. And then we also talked about in the article expected improvements in air quality resulting from current regulations. Again, we have upcoming the power plant regulations, including the cross-state air pollution rule and the mercury and air toxic standards. We have a series of industrial source regulations as well. Specifically, there are some large contributors, including industrial boilers and cement kilns, which have maximum achievable control technology standards that have been put in place. And then, as I mentioned, we have mobile source regulations, both from EPA, but also from state programs, especially in California, which has the California Goods Movement Program, which is expected to get significant reductions in diesel PM as well as in NOx. And the whole purpose of that last part of that write-up was to try to highlight the need for this workshop and get people interested in thinking about future research to look at these regulations. So moving on to the HEI experiences, and I toyed with the idea of putting up a graphic showing the Jimi Hendrix experience, and thought that I would put Aaron and Anneman on that, but then decided maybe that wouldn't go well. So, but anyway, the HEI experience has really been about early success stories in accountability research, and that particular article focused on a number of studies, including the Dublin coal ban and the follow-up studies that looked at coal bans in surrounding areas. And the original study showed that there was a significant decrease in black smoke and cardiovascular and respiratory mortality following the coal ban. And then a follow-up study in several smaller Irish towns showed that there was a reduction in respiratory mortality and cardiovascular hospital admissions, but not cardiovascular or total mortality. So there's a little more ambiguous results coming out of the follow-up studies. And also there was a 2002 study of a 1990 reduction in sulfur in fuel in Hong Kong, and that showed a 45% reduction in SO2 concentrations following the reduction in sulfur in fuel. But they were not able to detect an effect on PM and NO2, and they saw an increase in ozone. And again, this highlights the need to be able to look at what are the other factors that might affect these other measures. And they did see a decrease in mortality over 5 years with greater decreases in areas with greater SO2 reductions. But follow-up studies showed that there were longer-term reductions in PM, but had a harder time showing changes in life expectancy or mortality rates. So again, there was some mixed results on that. And then finally, so this is, and then generally speaking, there was a series of studies that looked at the Olympics. There was the 1996 Olympics, which showed a decrease in initial studies showed a decrease in pediatric asthma visits during the games associated with reductions in ozone, PM10, and carbon monoxide concentrations, but subsequent analysis showed that not all the changes in air quality were actually associated with the intervention. And this highlights the importance of identifying an adequate control population. And hopefully through the discussion today, we'll be talking about the importance of looking at adequate control. There were also a series of studies of local interventions. EPA and Montana have been working on a wood stove change-out program, and there was a panel study that went along with that. The 2008 Beijing Olympics, this was a prospectively planned set of analyses, and so they looked ahead and said, okay, we know this is going to be occurring. What can we do in terms of measurements to be able to make sure we can judge the effectiveness of the interventions for the Olympics? And they covered several different endpoints in populations. They looked at cardiovascular biomarkers, NO biomarkers in children, heart rate variability in taxi drivers, and they looked at an adult asthma outpatient visit endpoints. And then finally, there was a 2008 London low emission zone study that has been underway. They collected baseline data prior to the intervention, and then they added roadside monitoring, and that study is still underway. And then finally, Dr. Pope's summary, does reducing air pollution improve human health? And this evaluated how different types of natural experiments have informed discussions of accountability. And there was a series of different types of measures that were looked at, including labor disputes and intermittent operation of industrial sources, temporary Olympics-related interventions, which we discussed earlier with HEI, long-term local interventions, and then national emission controls and standards. And there's also a discussion of household-level interventions, but I'm not going to discuss those there because it's not really what we're going to be looking at. So in terms of labor disputes and plant shutdowns, the most famous of these was the shutdown of the local steel mill in Utah Valley in the 1980s. And this resulted in decreases in air pollution and reductions in pediatric respiratory hospital admissions, symptoms, school absences, cardiovascular mortality, and preterm birth. So there's been a lot of study of this particular event. And then there was also a broader regional program, not a program, but a regional impact when there was a copper smelter strike during the 1960s. And this affected 4 southwestern states and resulted in regional declines in sulfates and a measurable decrease in mortality. There were also long-term local interventions. We talked about the 1990 Dublin coal ban and the Hong Kong fuel sulfur reduction. There was also a couple of others, including the German reunification, which resulted in a very large-scale set of actions in response to that. But it did lead to decreases in air pollution and reductions in mortality risk. But again, the idea of being able to come up with a suitable control other than through time is somewhat difficult. And then finally, he mentioned the 2003 congestion charging in London. And again, this only showed small reductions in air pollution concentrations and mortality benefits, but this was because it, again, was not designed specifically to look at air pollution. There have been a couple of studies that have looked at national controls and standards. The most recent of which is a study by Correa et al. In 2012. And these both were looking, there's 2 studies that were looking at life expectancy. There was the first study that looked at life expectancy changes and PM changes from 1980 to 2000. And this showed that counties with greater reductions in air pollution also had greater increases in life expectancy. And the follow-up study, which just looked at the period from 2000 to 2007, which, as I mentioned earlier, had a much smaller change in air pollution, it still showed continued and proportional increases in life expectancy associated with air pollution decreases. And then finally, the Harvard 6-city study they also looked at changes in PM in those areas, and they showed that cities with greatest reductions in PM also had the greatest declines in mortality risk. And finally, I put this up because I thought it might be interesting, and it may or may not. But what I wanted to do was say, well, do we have coverage for all the different types of events? And so I looked at small-scale events and large-scale events, and then long-term outcomes and short-term outcomes. And you can see that there's pretty good coverage over most of these quadrants, with the exception of short-term interventions over large areas. But one thing I tried to also do was I highlighted in red those studies that use a prospective design that looks forward and said, okay, we know an intervention is going to happen. Can we measure outcomes, and can we conduct a study to look at those outcomes? And what you'll see is up here in the studies that looked at long-term responses over large scales, there are no studies that use a prospective design. And so that's part of what we want to do, I think, in the workshop today is decide, can we actually do this? Is it possible to look forward and prospectively plan for a study that looks at long-term responses to long-term interventions over large areas? And I think that's what I was trying to highlight here, is that there's a need for that type of planning to look at these long-term interventions for now.